everyone. Thank you for joining us for this MDA Engage community webinar on understanding the importance of physical therapy for the Pompe community. My name is Michelle Barrios, and I am the Community Education Specialist at MDA. We are thrilled to have you join us today for this important and educational webinar. The webinar today is part of our larger MDA Engage flagship community event series, which focuses on bringing the neuromuscular disease community together around education and social opportunities. Be sure to visit the MDA Engage section on mda.org for updates on upcoming virtual education events. We are recording today's event and will be posting it to the mda.org website for on-demand viewing to ensure that those who are not able to join us live today are able to access this information. Please know that all phone lines have been muted. We will be having a question and answer session towards the end of the webinar. Please be sure to utilize the Q&A window to type in your questions. If you hover over the bottom of your screen, a tray of webinar icons will appear. Click on the Q&A bubble to open the window and enter your question. You do not need to wait until the Q&A session to chat in your questions. As questions come up along the webinar, please feel free to send those in. Before we begin, I would like to say thank you to our speakers, whom you will meet shortly. I would also like to thank our event supporters, Amicus Therapeutics, Ask Bio, Astellas Gene Therapies, and Sanofi Genzyme. We would not be able to provide events like this if not for their generous support, so thank you very much. Let's review the objectives for today's webinar. Attendees will learn how physical therapy can positively impact individuals with Pompe disease, discover exercises individuals with Pompe can do at home, and discuss precautions to take around exercising. Now I would like to introduce our speakers. Scarlett Morris has practiced physical therapy in the Kansas City area since 2009. She is a board-certified orthopedic specialist and holds a certificate in orthopedic manual therapy. As a clinical assistant professor, Dr. Morris provides instruction in the University of Kansas Medical Center's Doctor of Physical Therapy program and presently teaches a course in acute physical therapy intervention, as well as 2 orthopedics courses. Due to her clinical expertise, Dr. Morris serves as a mentor and preceptor for students in a variety of settings, including the ALS Association Multidisciplinary Clinic, JSTART, Bulldog Pro Bono clinics, and previously served in the MDA Multidisciplinary Clinic at KUMC. Mary Crouch-Young is a clinical instructor in the Department of Physical Therapy, Rehabilitation Science, and Athletic Training at the University of Kansas Medical Center. Dr. Crouch-Young provides physical therapy services for Kansas City's MDA adult and pediatric multidisciplinary clinics, serves as the physical therapist and student preceptor in the University of Kansas Medical Center's Multiple Sclerosis Achievement Center and JSTAR Pro Bono Clinic. In addition, Dr. Crouch-Young provides home-based physical therapy services for survivors of acquired and traumatic brain injuries throughout the greater Kansas region. And with that, I would like to turn the webinar over to Scarlett and Mary.
Thank you, Michelle. Thank you for that kind introduction. As we get started today, I just hope that everyone attending is in somewhere that it's not quite as hot as it is in Kansas City today. Those are one of my wishes for you today. And thank you again, everyone, for joining us. I'm going to go ahead and share my slides now. All right. Michelle, can you let me know if you can see my slides, please?
We can see it. You are good to go.
All right, wonderful. Thank you. All right, so today we are going to be presenting on Pompe and exercise. And our emails are here on this first slide. If you decide, after this webinar, there's at some point you have a question, maybe that doesn't get answered during this, we'd invite you to just send us an email. So feel free to refer back to that. What we're going to cover today are some of the things that we're going to cover are going to include benefits of exercise. Some of these are the benefits of exercise in general, so they may sound familiar, but we're also going to cover the specific benefits for those with Pompe. We're also going to cover specific recommendations. Both Mary and I will cover some specifics for you. And we'll present some of the research that we found in preparing for this presentation. Again, trying to make it as specific as possible for those of you that may have Pompe or maybe a family member or someone that you care for with Pompe. We're also going to talk about some of the general and specific precautions and safety things with exercise and some of the things that you should watch out for, especially if you're starting a new exercise routine. So we're going to give you some heads up on specific things there to look out for, in addition to just kind of general things as far as safety with exercise. And then modifications specific to children and adults. And then we'll wrap up and have a Q&A time. So we definitely welcome you to put those questions into the chat as we go along and as those may come up. All right, so I'm going to get us started off. You probably all well know that Pompe affects muscle cells, and it affects muscle cells' ability to break down glycogen into glucose. And so what happens related to that in the muscle cell is that buildup can actually cause cell damage and cell injury and potentially cell death. But it's not necessarily every muscle cell. And so we'll get into some of the specifics of this. But some of the things that we see with Pompe is that it tends to affect the muscles, especially the muscles of breathing, muscles of the limbs, especially proximally. And what we mean by that is the ones closer to the shoulders or closer to the center of the body and the hips, and the trunk muscles as well, and potentially the heart, although we know that's not the case with everyone. So again, around the pelvis, shoulder blades, and particularly the muscles of the core. We know this can lead to a lack of strength, power, weakness, and fatigue is really common as well related to that. And some individuals with Pompe may experience an inability or an intolerance to exercise in the way we may think of as typical types of exercise, or even have difficulty with some EDLs or activities of daily living. And we're going to touch on some ideas in those instances as well. And we know that the weakness is progressive. So,
hi, Scarlett. Before you move on to the next slide, can I have you move closer to the microphone?
Yeah, I can move the computer closer as well. How's that?
There we go. You sound great now.
And, okay, great.
Awesome. Thank you.
Yeah, no problem. All right, so you may be asking yourself, is exercise appropriate for someone with Pompe, or could it even cause harm? And that's a great question if that's what you're wondering. And so I want to just, before we really get into any details, I want to say that it is not harmful in moderation. Like most things that we may enjoy in life, in moderation, it can actually be very beneficial. And so the research that we went through related specifically to Pompe, but also to other neurodegenerative diseases, shows that there are no side effects, or negative effects, I should say, of exercise therapy with Pompe disease to date. And this still emerging research, of course, but as far as what we're going to present, the types of exercise that we're going to recommend to you, there's really no need to be concerned that it is going to make things worse. Now, that being said, we always have some individuals that think, and I mean just people that we interact with as therapists, that take what we say and think if a little bit is good, a lot more is better, and that's not necessarily always the case. So I do want to caution you that intense, like say weightlifting, for example, powerlifting, that's not going to be what we recommend for someone with Pompe. And so if you were to go about maybe lifting intensely, or maxing out, things like that, where you're just taking yourself kind of beyond the point of fatigue and past the point of failure even with your muscles, then you may experience an increase in muscle damage. And that we know that's actually the case for people even without Pompe, but you may experience some side effects to that actually last. So that's kind of the only maybe overarching word of caution there. And I want you to know that A PT may help you if you have any of the points that we bring up today. We would really recommend thinking about a session with PT, even to kind of go through what may be most appropriate for you. Every individual is different, and we know that everyone may be at a different starting point as well. So a PT can help you implement a plan and then also monitor your routine, especially with light exercise. And the goal of this that I really want you to hear again before we get into any of the details is that the goal is to maintain muscle strength. Okay, so that is really maintain muscle strength and to maximize your functioning, and so that you can enjoy the things that you want to do. So that's really where we are coming from as far as our presentation goes. So the little image here on this one just reminds me of kind of the balance to exercise in general, but also to life in some ways. All right, some of the details of the types of exercise that we are going to discuss include general physical activity, which we think of differently than what we think of from therapeutic exercises or an exercise program that a physical therapist may recommend. So there is a bit of a difference there. So there's general physical exercise, which include daily gentle stretching, strengthening type of exercise, and aerobic exercise. And then there's also a really specific individualized, more rehab plan that a physical therapist may give you or prescribe to you that would include what we call therapeutic exercises, and that may also include respiratory training. And those may be exercises that you get recommended by a physical therapist, by a physician, and especially by a respiratory therapist. And we'll touch on those a bit later as well. So again, we're going to start by going through general benefits and then some of the specific benefits of how exercise can preserve function and movement, prevent complications, and preserve respiratory functioning, which is going to be one of the big benefits of course, aerobic exercise. So let me go ahead and dive in to the benefits of general exercise. So the benefits of physical activity. So this would include walking or things that you may already be doing as a part of your daily life. These types of activities help improve endurance for all of those daily activities, improved energy, and increase independence with self-care, work, and play. So being able to kind of have a general baseline of physical activity and maintenance is something that will help you continue with the things that you enjoy. We also know that benefit of physical activity includes improved sleep. Another benefit that we know of regular exercise is that it can improve your mood. That's definitely one of the things that I enjoy about exercise. So just 20 minutes of exercise can boost your mood for as much as 12 hours, according to one study out of the University of Vermont. And I mentioned this a little bit already, but the goal is to really maintain baseline functioning and to potentially slow progressive loss of functioning or progressive weakness that you may experience as a part of the disease process. Research shows that exercise, light to moderate intensity, does have the potential to slow this the progression. And one way that I want to explain that is that, because I get this question actually quite often in regards to kind of the right amount of exercise, but the right amount of exercise is kind of thinking along the lines of if anyone were to not move, say anyone were to just kind of not exercise at all, not move, you would experience muscle loss and muscle weakness. So what we want to do is not only maintain baseline, but maybe improve your baseline functioning, right? The goal is not necessarily to become a bodybuilder, of course. So that's just kind of where I want to make that, distinguish that difference there. Exercise to preserve function and movement can activate muscles that may not be as affected by Pompe, for example. And those, by kind of going about this strategically, can actually help support your movement and do it in a way that may provide for less pain and preserve the motion at your joints and just the flexibility of your muscles in general, which is always a good thing. We know, and research also shows that regular exercise can improve fatigue. Reports of fatigue, which sometimes seems counterintuitive, but if you think of it again, kind of as that baseline. And it can also improve pain because we know that exercise has a lot of benefits beyond just that time frame that you're doing the exercise. And this information, the piece specifically about fatigue and pain was from a study that was specifically done with individuals with Pompe to see what the effects of exercise were with pain, fatigue, and functioning. So it's good news. Exercise, I mentioned, can also help prevent some other complications that you may experience with Pompe. And again, everyone is different, but some of those could include joint contractures. We see those when people are not maybe as mobile, especially. So exercise and kind of normal movements and some of the stretching that we'll go through can really be helpful to prevent that. Regular exercise can also prevent injury to the bone that it just includes weakened bones from lack of challenge is probably the best way that I can explain it, or lack of a normal weight bearing. So weighted activities are really good for the bone, especially when you're lifting weights or walking, for example. And that can also help prevent changes to the spine that may include scoliosis. It can also improve posture and help prevent that decrease that you may experience with heart and lung functioning. So again, thinking about taking your baseline and bumping it up to kind of prevent some of the changes that we may expect with the disease process. Okay, cool. All right, so what we're going to go into now are some more of the specific exercise and activity recommendations that I'll recommend for anyone that is an adult who may have Pompe. So a comprehensive exercise plan should include all of these things: aerobic activity, functional strength training, balance, and balance can improve at any age, by the way. Core and trunk training to kind of isolate the areas that we know that you may experience more difficulty in, stretching, and respiratory rehab training. So again, we want to be strategic about it. All right, so general benefits of aerobic exercise kind of come from the idea and remembering, sometimes I think we forget, all of us, I know I do, that the heart is actually one of our biggest muscles in our body. So thinking about the heart as a muscle means that it can improve in endurance and it can improve in strength through exercise, through training. So some of the research really, especially in Pompe, really does support this fact that low workload aerobic training can improve general functioning and quality of life for people with neuromuscular diseases and also with Pompe. So again, that was something that came out of the research that we looked at to prepare for this presentation. So that's some of the good news that I really want to pass along, and I want you to hear that the efforts that you may be putting in will pay off, and research shows that that's the case. Thinking about aerobic reconditioning, and again, this may be that you decide that you are wanting to improve your baseline. So thinking about wanting to improve your baseline, this is some general recommendations for you when you are starting a new exercise program, or maybe you're even already doing one. Again, this comes from a specific study that we have linked, and we have all of these as active web links when this presentation becomes available to you after the webinar today. If you are interested in reading more into these articles, I just want to mention it now before I forget, to feel free to email us if you're having trouble accessing any of these, and we'll be happy to send you the full text, the full article. But getting back to kind of the point of this slide, thinking about what is the right amount, what is the balance when doing aerobic activity. So that could include walking, biking, swimming, whatever it is that you enjoy that gets your heart rate up, that you may do for say 15, 30 minutes at a time. So the recommendation is that you do work up to about 30 minutes per session, and that you do it 3 times a week. Again, you may have to work up to that, and really that would be my advice for anyone starting a new exercise program. And then that you do it at the intensity of what would be called moderate on this Borg scale. And Borg is just a fancy way of saying that it's the amount of exertion is what's on the scale. So you can see on the right-hand side, and with these kind of funny faces, to give you this idea of what moderate might look like, that it is a bit of a challenge, but it's definitely not to the point where you are struggling or having a lot of sweat, a lot of difficulty speaking, and definitely no difficulty breathing. So those are some of the things we'll mention. You'll hear us mention again later when we get into some of the safety things to watch out for. So you're below the threshold. Your heart rate is around 100 to 110 beats per minute. And you're around, I don't know if any of you, even some of our fitness apps or watches now help us calculate some of these things. So if this is familiar to you, the VO2 max around 60% and around 60% of your maximum heart rate. We've got a link a little bit later if you are curious or not sure how to calculate that. It'll give you, again, a link to find out how to do that. All right, and this is the point I'm going to pass it over to Mary, and she's going to talk through some more specific ideas for aerobic recommendations and kind of go into some more detail about general exercise recommendations.
Thank you, Scarlett. So there are several ways that we can get aerobic activity into our day. Activities that you can do either with special equipment or without special equipment. Special equipment would include walking on the treadmill, maybe using a recumbent bicycle or a new step cross trainer, maybe going and taking a community center class for chair aerobics or Zumba or aerobic dance. Or, if joining a community center isn't something that you want to do right now, there's always just free walking. With or without a portable ventilator if you require that. Swimming or aquatics is also a great way to get in aerobic exercise. And then there on the bottom right hand is the hand and foot pedaler combination. I really like this piece of equipment. You can use it for foot biking or hand biking, and those are affordable and portable to have at home. So those are really nice to utilize at home. Walking is great exercise, and so one of the things I want to just emphasize is that walking is simple and can be worked into your routine throughout the day and broken up into small increments if you need to. So if doing a 30-minute walk is exhausting, you can always do short walks, a lap around your house, to the end of the driveway, to the end of your block. You can also walk with a friend or walk with a man's best friend or alone by yourself. And if you choose to walk alone by yourself, I would always recommend having your phone handy for safety. I want to move into strength training recommendations. And of course, like Scarlett said, considering that we may be looking to improve some of those helper muscles. Some of the muscles affected by Pompe, we're looking really at that maintenance and slowing the progression of the course of the Pompe. So really, I think of this as strength maintaining recommendations is a great way to think about this. Functional body weight exercises are awesome to do throughout your day. You can do those at home with no equipment necessary. So when I think about functional activities, I'm thinking about the activities that mimic the things that we do every single day. They mimic the standing up from a chair, balancing if we have to shift our weight to reach for something out of reach, reaching overhead for something on a tall shelf. So sitting and standing, marching, raising up on heels and toes, push-ups on the wall, those are all great functional activities. If you wanted to utilize equipment for strength training or strength maintaining, resistance tubes, resistance bands, hand weights are great pieces of equipment to own. But if it's not in your budget or in your interest to purchase those, books at home, soup cans at home, you can fill a canvas bag with some books and utilize that for some movement as well. So along with strength training comes the idea of balance training. Balance training is really important for preventing falls, helping us get up and down from a chair, and just being able to turn and move with something in our hand and feel steady. So some ways that you can implement balance training into your day are just working to shift your weight side to side or front to back, just getting slightly outside of your base of support. Balancing on one foot or standing as if you were on a tightrope. Those are great ways to implement balance. I do want to say that the biggest takeaway from my perspective for balance is to stay safe. If you're putting yourself in a situation where you're going to be a little bit unsteady, then being close to a wall or being close to your kitchen sink or something that you can hold on to, that if you lose your balance, you can grip and it's not going to move with you. So anytime you implement balance, just make sure that you're safe about it. Our core muscles wrap around our body like an inner tube. So if you think about a child using an inner tube at the lake, that inner tube goes around our front, it goes around your back, and it goes around the sides. So those muscles incorporate all of our trunk. Our trunk muscles help to maintain our posture, and they help to make our transfers stronger. Our hips and our buttocks, our lower abdominals are part of our core, and those muscles are utilized when we stand up from sitting. Our trunk muscles improve our breathing, provide greater endurance when we're walking, when we're standing, improve our walking, and they help prevent falls as well. So they're very important to implement into your daily routine. So some ways that you can work on your core. First of all, I just want to say that your core can be worked in many, many different positions. I know we tend to think of that gym rat mode of doing sit-ups and crunches, but we can actually work our core sitting, standing on all fours, laying down, kneeling. So really focusing on the body positioning that's best for you, and not trying to get into a position that you feel you may not be able to get out of safely or independently. So some ways to work our core would include reaching and turning and weight shifting, and really some community-based exercises or YouTube videos for chair Pilates or Tai Chi. I do want to emphasize just avoiding traditional sit-ups. In general, they can be really hard on the back, they can be really hard on the body, and sit-ups can be a cause of injury in any person. This is a nice study, these pictures here with the plank and the side plank and the bridge. There was a study that looked specifically at individuals with Pompe, and they utilized these three exercises for their core activation, their core exercises. And the study found that after 12 weeks of working on these exercises 3 times a week, participants experienced an increase in both their stability and their balance. I want to say before we move on from this slide that all the participants in this study discussed finding it difficult to start with those exercises, and they needed some modifications. They may have put their knees down, they may have used a wall to start with, or used the support of a trusted friend. But with time, they found that increase. So for you, knowing that if you try these exercises and they're challenging, you can modify by placing your hands against a wall, by putting your knee down. There's a lot of ways that you can make things a little less challenging to start and build up at your own pace. Thinking about our core moves in 3 directions. We can move forward and back, we can move side to side, and we can rotate on an axis. And so these are 3 pictures that show ways that you can implement those 3 planes of motion, is what we call them. But really thinking about if you're working your core, consider going forward and back, side to side, and incorporating a twist into your workout. As we talk about stretching, I want to just reinforce what Scarlett said, that stretching can be beneficial to prevent early prevent contractures, and to really make sure that we prevent complications and we catch complications early. And complications may be where our joint doesn't want to move efficiently to help us transfer or walk or do whatever that activity is we'd like to do. With stretching, we always want to avoid pain. So general recommendations for stretching would be to stretch daily, and each muscle group that you stretch to stretch about 3 times for 30 seconds. And again, what we're looking for with stretching is really not necessarily over lengthening our muscles or creating added length to our muscles. If there is weakness and we create added length, that might create instability at our joints. So really just strengthening to maintain our motion, to make all of our activities easier for us, and to really maintain what we have. So we, looking at stretching, are thinking about stretching our hips, our hamstrings, which is the back side of the legs, ankles, our trunk muscles that we just discussed, and also stretching the shoulders, the wrists, and the forearms. You can think about doing chair yoga, having a partner assist you, or even utilizing a support of a strap or a gait belt. Those gait belts are really nice because they don't have any stretch. The stretching straps are nice because they have multiple loops so that you can incorporate lots of different hand holds and grips and positions with those. But again, emphasizing when we stretch, we should feel tension on the muscle that we're stretching, but not sharp pain. So if we're having pain, that's our body's way of telling us just to back out of that stretch a little bit so that we don't put ourselves at risk of injury. We want to avoid bouncing and ballistic movement with our stretches. So here are some recommendations, just some nice pictures. And what I want to emphasize with these pictures for upper body stretching is these individuals are incorporating the full range of motion of the stretch. But if you need to modify a stretch and have your body's position be slightly different, well, that's okay too. Do what's right for you. These are some recommendations for lower body stretching. I really like this picture because it shows for the lower body that you can be in any sort of position, sitting, standing, on your side, on your back. If you do incorporate a partner for your stretching, again, my biggest take home for you is that communication is the key. If you are having somebody help you with stretching, you can feel that stretch, but your partner cannot. And so let them know, okay, this is enough. I feel tension, but not pain. If you feel pain, ask them to just back out of that a little bit. A physical therapist can help you learn some stretches that a partner can do with you. So the last piece of kind of our exercise program would be to implement respiratory training into your daily routine. Respiratory training can help you maintain your heart and lung functioning, maintain a productive cough, which ultimately can decrease your risk of hospitalization, decrease your risk of pneumonia, and reduce shortness of breath. So some ways that you can train your respiratory system would be maybe using an incentive spirometer. That's a device that you can blow into, and it helps train the abdominal muscles and the lungs and the diaphragm. If you choose to use an incentive spirometer, I would say consult with your respiratory therapist for guidelines. If you're experiencing during exercise any shortness of breath at all, I would also encourage you to consult a respiratory therapist. Belly breathing is a great way that you can also breathe throughout the day to train your respiratory system. If you think of your belly as a balloon, when you breathe in, you should fill that balloon big with air, and when you exhale, that balloon should deflate again in your belly. So when we talk about exercise for children, many of the things we've already talked about apply, but children get bored with repetitions of doing 2 sets of 10 repetitions. They're going to get bored. So the best way for a child to really work their exercise is to encourage play. Go to the park. Get your child on the playground. There's lots of adaptive playgrounds as well popping up nationwide if your child needs an adaptive playground. Encourage family walks, walking the dog, time on your feet together. Encourage swimming as a family or aquatic physical therapy for children. Other ways that children can get exercise beyond free play would be utilizing a trike or a bike or a scooter. Gosh, kids love motion controlled video games. They love the Wii and the Xbox Fitness, and they love Just Dance. So if you have those in your home, those are great ways to encourage exercise. Adaptive sports is also very important for kiddos. And so we have a couple of links here, again, when the presentation is made available to you, that you can look up some different adaptive sports organizations nationwide. The MDA put out an article just a couple of weeks ago about the benefit of adaptive sports, and we've linked that here too. Some precautions and safety considerations before you begin exercising. I hope that Scarlett and I have piqued your interest and that you're ready to begin an exercise routine. If you're ready to begin an exercise routine, I would encourage you highly to consult with your physician and to make sure that you're medically cleared and safe to start exercising. Your physician may recommend screenings like the ones listed here on the screen, and I would encourage a yearly PT screening as well, just to talk to your PT and talk about the types of exercises you're doing and get some specific recommendations. Additional safety precautions. You want to avoid exercise that's aggressive. You want to avoid exercise that's high impact, high intensity. Like we talked about before, really maintaining that moderate level intensity, and avoid pushing through pain, avoid pushing through fatigue. Selecting exercises that are appropriate for your level and your needs. If you need to sit down to exercise, that's great. Helping with the grip, if there needs to be some sort of modification for your hand grip, a modification to prevent a fall, those are great too. My recommendation is to start slowly and to rest whenever you need to. After exercise, you should be able to recover pretty quickly. So a general precaution would be if you've exercised and it's an hour later and you're still really, really fatigued, that may be a little bit too much. That 30 minutes to 1 hour window is a really good, solid window. You may be a little tired for that time frame, but then you should feel better after that. After you exercise, you should have enough energy for all your other daily activities. Exercise shouldn't put you out for the day. So having enough energy to be able to take care of tasks around your home or go back to work. And having enough energy to be safe. If you have exercised so much that you feel off balance or feel like you may not be safe to get up and down from a chair or from the toilet, then that's a sign that you may have overexercised. So how do you know if you overdid it? I like to think about 3 things. I like to think about soreness in the muscles, fatigue, and risk of falling. If you have that delayed onset muscle soreness, which is that 24 to 48 hour window of muscle soreness, and you have soreness within that window, you may have overdone it. One way to prevent that soreness is to start slow. Maybe consider about half of what you think you might be able to do. Try out your exercise routine. If you're feeling good, the next time you exercise, you can boost it up by about 10%. And you can work that up to find your level, your appropriate level. Like I said, if you have fatigue over an hour later, then that may be a sign that you've done too much for the day. If you need a long, long nap, or you're just not feeling rested after you take a short nap, then that may be a sign you've overdone it. And then if you just have increased episodes of close calls, near falls, places where you have to catch yourself suddenly because you're losing your balance, then that may be a sign that you've overdone it as well. Then Scarlett's going to tell us a little bit about how to monitor your exercise tolerance.
Yeah. So thanks, Mary. So as we're going through this, I'm thinking of a couple of other things that I just want to mention about exercise, especially if you're in the heat or really humid, you know, working out outside or going for that walk outside. Thinking about doing that, you probably already are, but doing it early in the morning or when that heat index isn't as high. Another thing to consider is that pool or water therapy or even aerobics tends to be, you tend to feel more fatigue after, not necessarily in the pool. So just be aware of that if that's not something that you're as familiar with. All right, so this slide here is to give you a little bit more detail about, again, how to know, how to monitor, and how to gauge how much effort and how much you're doing is at the right amount. So ask yourself, I think one of the best ways, because you know your body better than anyone else on the planet, how do you feel immediately after? How do you feel 1 hour or even that next day or the 2 days later? So rate how you're feeling on that scale that we mentioned earlier. This is the link about how to check your heart rate. And from this link, I believe you can also find out what your max heart rate would be as well. And then that percentage of that is what I had mentioned earlier. The O2 saturation, that is how much oxygen is in your blood at any given point. The picture here that you see at the bottom right is a pulse oximeter, is this little device. You've probably had these used on you at some point, maybe when you've been in a clinic, you know, for just a checkup even. So what this does is it will take your heart rate and it will also take that pulse oxygen saturation. So these can actually be purchased online. You don't need any special prescription or anything like that. You can buy them on Amazon for about 15 to 30 bucks. So you can definitely spend more money if you would like, but these tend to work fairly well. So what you would be wanting to look at on there is what, if anything, really happens to your oxygenation rate as you exercise and after. Most people actually see a slight increase when they exercise because they are inhaling more deeply. So ideal is 100%. Anything above 95% is also, we consider, really good. When you get between 90 and 95, that's not so good, but not concerning. Anything below 90, and I would definitely say you need to stop, take a break, take some deep breaths. That's not what we want to see. If you find that your baseline is lower, that may also be a sign that you need to talk to your physician about that, and especially mention that to a respiratory therapist if you are already working with one. Or that may be a sign that you may need to get some testing done in that area. Again, just something to monitor, not necessarily, if you do see that lower number, it's not necessarily a sign of like a life and death situation by any means, because these things can have, it's not 100% accuracy. So I do want to mention that as well, but it's something easy you can do. It's really quick. You just stick your finger in there. Easy that you can do at home on your own. All right. So some strategies to avoid overexertion. We've mentioned a few of these already, but these are things that we say all the time in clinic, to take frequent breaks. We don't want you to have the mentality that no pain, no gain. That is actually the opposite of what we say as physical therapists, at least speaking for us. So we just don't want you to have that mentality, because we actually would say that the quality is probably better than the quantity. We want it to be something you enjoy. Take frequent rest breaks, hydrate, super important for your muscles. They're not going to work well or feel good if you're not hydrated. Complete similar activities all at once. You may even choose to stretch in bed because you may already be in the position that you're going to do your stretches in. So find ways to incorporate these things throughout the day, throughout your normal daily routine. Plan more fatiguing tasks earlier in the day. I know that's something that I actually do myself, just so that I'm actually more successful to do those things that may require more energy. So those are strategies that we would definitely recommend. We're coming up close to our end, and this is just one thing I wanted to touch on that we found in the research that I thought was really interesting to share with you all, that exercise training in combination with a high-protein diet for patients with late onset Pompe, if in combination again with that exercise training, can actually reverse the decrease that is typically seen, the decrease as far as in muscle power and aerobic capacity of the muscles. And it was also reported to improve the quality of life for the participants in this study. So this was just something that I found super interesting, also very encouraging. So again, this is one that we linked, and I would just recommend that you don't just go start eating as much protein as you can find, but that this would be something that you maybe decide to speak to your physician or even to your therapist about. This is emerging research. This just came out this last year. So again, don't bank everything on one single research article, but I think this is perhaps something up and coming that I would recommend that you, again, ask someone about, or even if you have a dietitian that you consult, I would definitely recommend just discussing this as a potential, because it has some promise for sure. All right, so to go ahead and kind of conclude what we've covered today, most studies that we looked at, and based on our recommendation as well from working in the clinic and working with people that we've seen in clinic who do have neuromuscular diseases, would be still to recommend the things that we do for most people: aerobic exercise 3 to 7 days per week, around that 60 to 70% of your kind of max load or max heart rate. Somewhere around 20 to 40 minutes would be ideal. Again, you may have to work up to that. Resistance training should be included because it has benefits to your muscles and as well as your bones. 2 to 3 days a week, around 3 sets of 10 to 20 reps, depending on exactly what it is you're doing. And again, at a moderate intensity. We recommend that you include core stabilization into your plan. Some daily light stretching, maybe about 5 to 10 minutes of stretching. I wouldn't recommend a whole lot more, but again, it should feel good. The stretching should feel good when you do it. Daily breathing, respiratory, spirometry, however that looks for you. Even the belly breathing would be a great place to start. That has also been shown to decrease stress as well. There's a lot of research for that deep breathing. So there's a lot of reasons to recommend some of these things. We really want to encourage you. Hopefully we've given you some ideas about exercise specifically, but maybe we've piqued your interest related to some of the research that we've talked about. So we want you to please discuss this with your care team. And if you need any help finding a care team or kind of locating those people, I know the MDA Association is a great resource for you to kind of locate other people that you may incorporate into your team. And these are some of the ones that we would really recommend, some of the ones that we've mentioned in our presentation today.
So I want to finish out by encouraging you as you're starting off on maybe a new exercise routine or thinking about ways to incorporate what we've talked about into your pre-existing routine. I want to encourage you to find things that you like to do. Exercise should be fun. It shouldn't be arduous and tedious. You should have fun doing it. So find the things you like. Incorporate movement throughout your day in small increments. A little bit can go a long way. So if you're finding it hard to get 30 minutes in, just walk an extra lap around your island in your kitchen. Before you get up from the dinner table, sit and stand a few times and get some movement to those hip muscles. Have a TheraBand next to your couch while you're watching TV, or a soup can next to your couch, and do some, a few things with your arms. When you're at your kitchen sink, balance on your heels and toes, just a little bit throughout the day. And again, stretch in small increments. When you feel like you need a stretch, when you think about stretching, that tends to be a good time to incorporate that. Ways that you can kind of remind yourself to exercise. If you're having trouble fitting it into your day, you can always set alarms on your phone, keep a bullet journal, keep a calendar, find an exercise buddy who can hold you accountable. Join a community center class where you know that at 3 o'clock on Thursday is chair Zumba. Whatever you're doing to exercise, any sort of daily routine builds good habits. And good habits over time help with everything that we've talked about today. So in conclusion, I just want to point to our references. These are the articles that we referred to when we were creating this presentation. Again, this presentation will be made available to you on the MDA website. And these links are hyperlinks, so that you should be able to click on those to access the articles. If you're having any trouble at all accessing these articles, if you want to learn more, you can always reach out to Scarlett or myself. Our email is at the front of this presentation on the first slide. So finally, we collectively want to thank the MDA for having us, from Michelle Barrios to reaching out to us. It's just been a pleasure to be here and do this presentation for you. We also want to thank you, the attendees, for giving us your time today and for taking the time to listen to our presentation. We do have time for question and answer, and we're excited to answer your questions today. So thank you.
Thank you so much, Scarlett and Mary, for all of that great information. We do already have some questions, but if there are any additional, like I previously mentioned in the beginning of the webinar, if you hover over the bottom of your screen, you'll see a Q&A bubble. You'll want to click on the bubble and type in the questions. So let me get started. One of the questions here says that, can we clarify that it does not exclusively affect muscle cells, in the sense that GAA is not functioning correctly in any cell, not just muscle?
Sure, that's a good point. I think we just tended to focus on muscle related to our presentation with the exercise, but yeah, that's a good point.
We have another question that you may or may not know, but I'll ask it anyway. Are you familiar with the more recent research out of Hungary about maximal resistance exercise? I don't know how deep your research is in Hungary, but have you heard of anything?
I don't think I looked at anything in particular with that, but I'd be happy to, if you had something particular in mind that you wanted to share with us via email, be happy to, take a look or comment on it.
Thank you. We do have a comment that came in that says, these stretches are so important. Wow, love this. So thank you very much.
Good. We're glad to give you some ideas and to provide a visual that you can reference when you're stretching throughout the day.
Another question that has come in is, do you think a nutritional consultant is a good option?
Absolutely. We both encourage that multidisciplinary strategy for your care with Pompe, and a nutritionist should be part of your multidisciplinary care team. A nutritionist can discuss any other needs you have for dietary restrictions, can discuss protein intake, water intake, and carbohydrate intake, and all that's very important.
Awesome. I don't see any more questions coming in. I think your presentation was so full of such good information that you may have answered everyone's questions.
Great.
Yeah, that's awesome. We'll give it just a few more.
We're happy to answer more if they roll in, and I would also encourage attendees to consider, and maybe if you have this in the comments section, what are some strategies that you use to employ exercise into your daily routine? Maybe the attendees have some ideas for everyone else out there listening.
Yeah, absolutely, great point. One of our attendees wants to know how much protein is needed, like maybe in your diet.
Yeah, so that's where I think you would have to really have someone like a nutritionist or a dietitian look at you in particular, your body build, and help you determine what's appropriate. Because I do want to caution you not to just eat everything you can with protein without consulting someone, because that can actually be really hard on your kidneys, especially if you're not drinking enough water with it. Mm-hmm. So that is one kind of word of caution. So I don't have one, a specific number to recommend to you. You could look at that article for sure, but even by looking at that, I would really recommend that you at the very least kind of consult with your physician before you, kind of embark on making big increases and changes there.
Yeah. Medication, body weight, water intake, any other sorts of medical needs that you have can all affect how much protein you should take into your diet. So contacting a nutritionist and your physician is really your best bet for learning the answer to that question.
Yeah, the last thing we want to do is cause, other new problems, right? Or other issues. That's the last thing that we want. So again, this is just something that we want to kind of maybe pique your interest, but we do think you should, consult somebody to make it more individualized to you.
Mm-hmm. One of our attendees is asking about online nutritionists or dietitians that we recommend for Pompe, as well as online physical therapists. So I'll start with nutritionists and dietitians. So if you're looking for someone who has worked with people diagnosed with Pompe, I would suggest to reach out to our MDA Resource Center, who can connect you to a nutritionist who is in our MDA Care Center network, who will have more experience in dealing with individuals with Pompe, as opposed to just, Googling nutritionist or dietitian. And then, do you know of any online physical therapists as well, since it is difficult to drive, or centers that can come to your home? Do either of you do telehealth?
We have, yes. I think I won't say every physical therapist has over the last year, but many of us have become very well versed in telehealth at some point over the last year and a half or so. I would reach out to your local, MDA chapter for recommendations. Even if they're not actively doing it right now, they may be able to offer that. So that would be my first recommendation. And every state actually does have different regulations in regards to what they will allow physical therapists to do in regards to telehealth. Most restrictions got waived over the last year, but that is actually one thing that we're trying to advocate that can continue, so that you do have more increased access to services that you really need, like that telehealth. So those are just some thoughts that come to mind, and I'll let Mary address that as well.
Well, you took the words right out of my mouth. So absolutely, I would say reach out to your local chapter. They can provide you with more information about who's local to you. And also they may be able to help you find somebody that can understand the telehealth regulations in your state.
Yeah, and unfortunately, sometimes insurance does limit that to some degree as well. But again, that's something that I would recommend that you really ask for, because we think that it is incredibly helpful, and we would rather you get care as often as you need it as well, in the format that you need it. So that's something that we definitely want to do more of and continue to offer as physical therapists. So you may have to really, depending on where you're at and your insurance, you may have to really do a bit of investigating.
Yeah, I would say to also reach out to the MDA Resource Center for that one as well. They can find, they work all across the country, so they can find you a physical therapist or nutritionist or dietitian in whatever state you live in. We have one last question. What can you say if you're low on, it says, I think it's creatine supplements. I don't know if that makes sense. Yeah, we're gonna need some more detail on that one. On that question. I do have a comment on the Hungarian research. It's the paper challenges the thought that going too hard causes more damage in Pompe than non-Pompe. So they wanted to clarify the research for you.
Thank you. Just to respond to supplements in general, not necessarily creatine, but just general supplementation in your diet. Again, I would point you to your nutritionist and your physician to determine if supplementation is appropriate for you, and how much and what supplements to use.
Yeah, because they are regulated differently, sometimes the brands matter as well. So that's where really that expert nutritionist will be able to direct you in a good direction. Yeah.
Well, I don't see any more questions, so I would like to thank our guest speakers, Scarlett and Mary. We sincerely appreciate your time and expertise and everything you do for the neuromuscular community. So thank you very much for being here today.
Thank you.
Thank you.
We would love to hear your comments about this webinar. If you have a smartphone, open your camera and point it at the QR code on the screen. A web page will pop up with a short survey on today's webinar. If you do not have a smartphone, once the webinar is over, a screen will pop up with the survey as well. Also, thank you again to our event sponsors, Amicus Therapeutics, Ask Bio, Astellas Gene Therapies, and Sanofi Genzyme. We would not be able to provide events like this if not for their generous support, so thank you very much. Anyone has questions after this webinar, please feel free to email them to mdangage@mdausa.org, and we will follow back up with you. If you are new to MDA through this program and are diagnosed with Pompe disease or are a loved one of someone who is diagnosed, we encourage you to stay engaged with MDA. You can do this by visiting mda.org/join and completing a short form. This concludes today's MDA Engage webinar, Physical Therapy, Exercise, and Pompe disease. Thank you very much for attending. Thank you, Scarlett and Mary, and have a great rest of your day, everyone. Thank you.